and now you know very well about. Before you have seen, I think there are many videos. That's what I have taken oath. I just taken oath to complete what my basically purpose, and you know very well about my purpose is to take challenge and just to complete your challenge. That's my main purpose. Before you have seen also, I think there are many videos which I have completed. So this is the another video which I am started to completing the pages, the number of pages, and you can see, you can look right now. I just show you there are some pages, there are some left. You can see this is the number of pages which is present, so I have to complete. So what I will see, that's how many time we're taking to, if one time I just reading and wants to completing through by understanding what actually written, and then next time I will only remember. Right now just I am reading, go through and just understanding the concept. Next time I will try to remember the things. So in this way I'm doing in that way, that suppose if I'm studying 1 hour from this kind of if I'm doing, and I just motivate and I just want to finish the challenge, the task, it anyhow if taking 2 hours 3 hours, okay, it's no problem, I am ready. Because when I'm coming in front of camera, then I am more active on that stance, how to finish whatever I have taken oath and to complete the challenge task. That's my main purpose, and I find really am helpful this kind of when I just making setup, and it helped me boost my confidence, something to do. Yes, if you take an oath, just you have to complete this task. This is the great thing. Is recording? Yeah, okay, it's recording. Yeah, fine. So let us start. Let's see how many time it's taking. I think there are a number of pages. I think approx 16, or it might be something. Okay, let's see. 20 plus, I'm sure. Not 20 plus. I think it's more. 30 plus. Yeah. Let's see. I will speak in front of you. That's whatever I'm studying, and the words, the sentences, the effect, whatever. So let us start. Actually, I'm studying here. Actually, the questions about metronidazoles, 4 uses, adverse effect, 4 therapeutic use with respect to place in therapy, dose frequency, route of administrations, duration of treatment. These are I'm studying. So let's study once more. Metronidazole. Metronidazole. Actually, definition, what is metronidazole? So if someone there is the question given that metronidazole. Suppose if you don't know, then how to attempt that thing. So you have to pay attention. First is, if you don't know anything else, what you do? You have no need to like just fill the copy. Just you have to make the lengthy answers. This is the not case. The case is that you just make in that way. Just just a metronidazole. You know, metronidazole basically it is antibacterial. Sorry, antimicrobial. So if antimicrobial drugs affecting against anaerobic bacteria and certain protozoa. So I think it will be the long. So metronidazole is an antimicrobial drug. So you can put here anything, just like you don't know any other kind of thing. You just forget when you're just going in the examination hall, and just you forget what the metronidazole, what I'm study and definition, adverse effect, dose, frequency, whatever. Just you forget. So you can do in that way. If it is a microbial, antimicrobial drug, so what you can write, it prevent to just like you can mention, it prevent to growth of microorganisms. So in that way you can little bit in that way just think in your mind, just you in the right way. Definitely it will be the right, yes. Antimicrobial means it's working against the microorganism. If here is a macroorganism, so this bacteria will help to prevent you from the attacking in your body. So we can use in our mind just when you forget. So there is need to learn and remember whatever I am studying, whatever you learning through, you just make the concept. If I am studying the drugs of metronidazole, so I have to remember by understanding, not to remember directly. If just understanding by thinking in your mind, yes, this is a drug, this can be the prevent, this can be the adverse effect, and this can be the uses of the drugs, and the adverse effects, the important therapeutic points. When you understand, and it will be more clear for us to write, and the chances of getting forgetting less. So I think we need to do in that way, it will be more easier for us to and you can, if just suppose if you forget later, it will help to, it will help to make again but on your mind, just because you understand the concept and you can use in your mind, and you can make by on yourself the, there are some points from yourself. Great things. So let's study. Metronidazole is a nitromidazole antimicrobial drugs. Here is mentioned nitroimidazole antimicrobial drugs, effective against anaerobic bacteria and certain protozoa. For therapeutic use is placed in therapy. There is mention in the question about for therapeutic uses with respect to place in therapy, dose frequency. Am I right? Yes, here is mentioned. Adverse effects. There is first written about the 4 uses of metronidazole adverse effect. Next, 4 therapeutic uses with respect to place in therapy. Place in therapy. Place in therapy, what means you understand? Place in therapy, 4 therapeutic use. 4 therapeutic is, we have to 4 therapeutic use mentioned, just like therapeutic uses, just like amoebiasis, giardiasis, trichomoniasis, anaerobic bacterial infections. And now we will make the table of place in therapy. And now dose frequency, route of drug administrations. Dose frequency and route of drug administration we can write from the same point. Dose and route of frequency. Dose of frequency and route of administration. So we will write dose and route. What is the dose? Suppose if I am talking about amoebiasis, drug of choice for invasive intestinal amoebiasis. It means amoebic dysentery followed by a luminal amoebicide. So there is the dose 400 to 800 mg and route is orally 3 times daily. 3 times daily. And duration of treatments. If you're giving the dose of frequency and route of drug administrations, and what is the durations of the treatment? How many time, how many day you will give the drugs or the medicines to the patient? Just like it's given for therapeutic use, it's given just like amoebiasis, drug of choice for invasive intestinal amoebiasis, there is 400 to 800 mg. It's given the durations 5 to 10 days. Another drugs, giardiasis, effective anti-protozoal drugs. This is giardiasis, which is effective anti-protozoa drug, and we will give the dose and route. 250 mg orally 3 times daily. We will give the duration of medicine 5 to 7 days, I can say 1 week. Trichomoniasis, drug of choice, treat sexual partner simultaneously. Drug of choice, treat sexual partner simultaneously. If I'm recording, yes, I'm going to recording, right? Often used with other appropriate antibiotics depending on site. And if I'm talking about use 5 to 10 days depending on infections and clinical response. And now important therapeutic points is in amoebiasis, metronidazole treat the tissue invasive phase. Just to look that right now someone is crying or like actually right now what is the time I just show you. You will look. Yes, I'm coming. I come. And you can look the time. You can look very well about time is and day. You can look. Oh shit, sorry. Right now I'm just scared when exam is come near. Really I'm very scared. You can look about. There is time is 12:56 Thursday 27 August. And many one think about that how I will understand about this is AM or PM. Many one think about. I'm just showing you in the Google. I'm searching with yes. Oh my goodness, right now the network issue. Okay, no problem. Yeah, yes, I just got it. What I have written, I just giving the brightness. Yes, you can look what I have searched. Shit, man. Exactly time now with AM or PM. And you can also look right now. There is 57. It's 12:57 AM. Thursday, 27 August, 226. Time in Bihar. And this is pin code cancer. You know very well, but still, I will show you in the 3 AM. I will show you. Okay. If I am probably study 3 p.m. I'm definitely I will show you. Okay. So can I use the study music right now? I think no. Let's leave it. First I need to study. I have to finish. I have to finish the task. Then I will do any other extra curriculum because I need to study. I need to finish about now. Okay. Amoebiasis, a metronidazole treat the tissue invasive phase, but it does not reliable eradicate intestinal cyst. Therefore, illuminal amoebiasis such as the loxinoid furoate given after the tissue culture treatments. Adverse effect: nausea, vomiting, abdominal discomfort, diarrhea, metallic taste, headache, dizziness. If important with prolonged and high dose therapy and giving the prolonged long time Peripheral neuropathy, it can be the peripheral neuropathy, okay? Rare CNS effects such as seizures and encephalopathy. Rare CNS effect and encephalopathy. Important interaction is that avoid alcohol during treatment of and for at least 40 hours after the last dose, because sulfiram like reaction may occur. So that's why there is giving cautions for to withdraw the alcohol. Now another question is microsomal enzyme inductions. Microsomal enzyme induction, clinical consequence with two examples, implication with him. Microsomal enzyme is the process microsomal enzyme induction. There is a microsomal enzyme induction, okay? Microsomal enzyme induction is the process by which repeated administration of certain drug increases the synthesis and actively hepatic microsomal drug metabolizing enzyme, resulting in accelerated metabolism of the inducer and or other drugs. This is very long definitions, but I need to write by my own sentences, and really I not understand properly what actually here making to us understand microsomal enzyme inductions. What is microsomal enzyme inductions? How I will write through my own words. Microsomal enzyme induction. Question is enzyme inductions, clinical consequence with two examples, implications with example, two example, and next implication with example. Microsomal enzyme induction is the process by which repeated administration of certain drug. Microsomal enzyme induction is the process by which repeated administration of certain drug increase the synthesis and activity of hepatic microsomal drug metabolizing enzyme. What here making to us activity of hepatic microsomal drug metabolizing enzyme, resulting in accelerated metabolism of the inducer and or other drugs. Still I have not understand. Example of enzyme inducer. What is the example of enzyme inducers? Yes, it is written here about with two example. Enzyme inducer. Example of enzyme inducer. Enzyme inducer: rifampicins, phenytoins, phenobarbitons, carbamazepine. And clinical consequence. Clinical consequences: decrease effect of other drug, decrease effect of other drugs. When microsomal enzyme is induced, what the effect of the drug? The effect of the drug is induced. Enzyme induction increase metabolisms. When enzyme is induced, there is the increases metabolisms. If increases metabolisms, what will happen? Decrease plasma concentrations. If increase plasma concentration, then what will happen? There will be the decreased therapeutic effect of other drug. It means whatever you're taking the drugs, there is induced microsomal enzyme which increases the metabolism, and if the increases metabolism, there will be the decrease of plasma concentration. If there will be the decrease of plasma concentrations, then therapeutic effect of the other drug will be decreased. Examples: rifampicins, increased metabolism of orally, and contraceptive, decreased contraceptive efficacy and contraceptive failure. And duration, decreased durations. One is I have mentioned decrease effect of other drug, decrease effect of other drugs, and second one is decrease duration of action of drug. It means it decreases the duration action of drug. It means that suppose if one drug which taking the action to of suppose 10 minutes, but what here is going, this enzyme, microsomal enzyme, what's they're doing here is doing the decrease the duration of the action of drug. It means if they're taking to spreading, or it's the functioning of this 10 minutes, but it reduces the duration of the action is to it's just 8 minutes. It's taking the 10 minutes. If someone is drugs which is to spreading in our body is taking time to spreading, and it's taking times to have to main functions the 10 minutes, but this enzyme which induces which decreases the functions or duration of the drugs, increase metabolism, drug is eliminated faster. If suppose if you're taking some drug just like a rifampicins, and the metabolism is increases, so drug is eliminated faster. If the metabolism is so fast, so the drug will be eliminated soon, so the effective action you will not find. The effective actions, it will not work, and you will not be satisfied. You will not be it will be whatever your health injurious, it will be you live on the same conditions. Now example is phenytoins. This is the subject which is need to learn and remember. Just you associate it by yourself, because if you are just remember easily, okay, it's fine. But I feel, and I don't know whoever feel, but I feel that I just really suppose if I'm learning right now without understanding, without just associate with someone to understanding and just connecting to any other things, when I'm just doing like this, it's I feel good, because I know, because I can easily explain. And when I remember without understanding, without associated or linked to other one, I am not such more time to exist in my mind, just disappear, I think just some hours. So that's why I'm trying to linking with myself and explaining, because it helped me to explaining, and it's thinking me to something explain, and I can explain without hesitations. And right now I just speaking in front of camera, it means this boost my confidence to something speaking in front of camera. It's what I can say, it's overcome my hesitation, it's overcome my fear in front of camera. Just you're looking right now, and many ones say that in comment section that yeah, this is the not case. When the real condition is happening, then you will be agitated. Yes, definitely you're saying right, but I'm trying from this level, and that next level, what the future will come, then I will see. I just want to find the good comment section. I don't know why there is many toxic people are there. They only just doing you just they only just giving and comment in the negative way, that you do not do, you can't do anything else like this. Why someone they doing like this? If someone they wants to do a big thing, if someone want to do succeed in their life, but someone they just give their leg, just they want to just, what I can say, you know very well about. So that's why I'm trying to find the good comment section, but I'm no problem, anyone can comment. It's not, there is your freedom, so you can do anything else, your own capability, your own thinking level. But you if you go if you in the right way, a right direction, definitely it will be a good persons or noble persons. A noble person, a gentleman, we will consider then when they have a kindness, then we will consider this he is noble man. Otherwise, no, you will not, never will find this kind of person or anything else. So okay, let's leave it that topic, because my mindset is not to discussing like this. So if I am uh, I'm just waiting for my exam, because there are only I think 20 days are left. So just I will upload continuously, I think 15 days. The next 4 days basically I will punctuality, I will study my the main subject, because I am just mix subject I am studying. On the 2 or 3 days I will try to upload video. Basic, I will not try to upload 4 days video, it's might be I think. And I will confirm the in next time, if the time will come, and if my preparation is going so hard, more well, so it's no problem. Still I'm preparing very well. Still if I'm discussing like this, it means if I just associate it with different cases, it help me, it give me confidence to something explaining in front of camera, in front by myself. I'm learning something to speaking, I'm not to speaking or anything else. Just like I'm just only remembering like this: Microsoft engine index and clinical consequence with 2 examples, implication with 2 examples. Actually, I'm not learning just like a rattamar like this. I'm not learning that manner, because if I'm learning that manner, I think I will not understand the thing in our surrounding to something explaining. You have seen, just you have studied about the physics. So what is the concept of physics? Something working like this. So in that way, just I'm trying to understanding in that way, because I know in examination time I have not need to study all the thing. I have to study the only important things which basically help me in the examination and also in future. So this is the my notebook. Now you can consider, yes, this is a PDF where there are the most important question are there. So basically I just, you can look also, there is, I have also tick mark, you can look also tick mark, and basically that question I'm basically studying. Because in examination, if you have a 1 month, it is not possible to complete the all subjects, all the things. You have to just like most important thing you have to cover, and that's the thing is enough for you. And I will definitely, I'm trying my best to complete the important things, and that's the decisions I have, and I just taking and studying with you like this. Okay, and I'm just going here that phenatoins example. This is increased metabolism, drug is eliminated faster, shorter duration of action. So shorter duration of actions, it means it cannot be killed or microorganism such more, it cannot be killed such more, it will be the somewhere how it will be the left, and it will cause you whatever you're facing the problem, the same conditions. That's the thing. Example is phenatoins increase metabolism of corticosteroid, reduce therapeutic effect. Now development tolerance, if I'm talking about development tolerance, increased metabolism of the reducing drug itself may result in reducing drug effect with continuous use. Example, if you know barbiton can induce its own metabolisms to some extent. Increase, fourth one is, third one I have discussed about development tolerance. Development tolerance, and this is increased toxicity due to reactive metabolites. Enzyme inductions can increase formations of toxic metabolites. Yes, this enzyme inductions can increase formations of toxic metabolite of some drug. It can increase formation of toxic metabolites. This is the power of enzyme inductions. Microsomal enzyme induction. Power of microsomal enzyme induction is increased toxicity. Power of enzyme microsomal is development of tolerance. Development of tolerance, something or like a resistance. That's we can say. Increased metabolism of the inducing drug itself may result in reduced drug effect with continued use. This is the development of tolerance. And decreased duration of action of drugs, microsomal enzyme, and First one is decrease the effect of other drug. Decrease the effect of other drug. I have discussed. Okay. So let's go to another questions. Another examples, phenobarbital. This phenobarbital increase CIP activity, increase conversions of paracetamol to its toxic metabolisms, particularly when hepatic glutathione is depleted. And now fifth one is drug interactions. Enzyme induce an important cause of pharmacokinetics drug interactions. Example, rifampicin, warfarin. Induce warfarin metabolism, reduce anticoagulants. Now, third is important example of enzyme inducers. So, important example of enzyme in rifampicin, phenytoins, and now the functions consequence. Important consequences: rifampicin decrease the effect of oral contraceptive, warfarin, and many other drugs. Phenytoin decrease the effect of oral contraceptive, warfarin, and corticosteroids. Okay. Now phenobarbital increase metabolism of several drugs. This phenobarbital will increase metabolism of several drugs. Phenobarbital and carbamazepine decrease the effect of oral contraceptive, decrease the effect of oral contraceptive and other drugs. Now the another questions, actually macrosomal enzyme inducers. So I have studied this is a 2-star questions. And next one is factor affecting drug actions. This is also the 2-star questions. Describe with clinical relevance, enumerate, describe with examples. Yes, it's recording. Factor affecting drug actions. What is the factor which affecting the drug? Just to think about something. What will be the factor which can affect the drugs? What will be the factors? It can be the external, it can be the internal. It means when you're taking the body, or it can be the external features. What can be the external feature will come, internal feature will come. That's something talking about when you something study, just you talking about some drug, just to think in your mind, because when you correlate, when you something like this, you can write the any other also other thing that which will be your teachers, which will be your uh, academic teachers or faculty. It will be more satisfied from you that when you something explaining. So in that way I'm trying to something explaining, but somehow it's taking time. I already told you that it's taking time, no problem. Just give you time. This is the main thing. If you're not giving time, we cannot accept anything. We need to give time. Yeah, this is the most important thing. Okay, I just try to complete. I just why I'm discussing like this, because I no need to, because I just want to make one video. Just I will cover the many things, whatever in a surrounding, whatever is going, what we can do, our best effort from yourself, from ourselves. So like this I will try to upload the video, because I need to study. I have taken notes, so I have to complete. So okay, continue. Factor affecting drug action is age. Okay. Age. Age affect drug absorptions, distribution, metabolism, excretion, and as well as sensitivity of drugs. We know the think about ADME, ADME, absorption, distribution, metabolism, and excretions. So absorptions, distributions, metabolism, and excretions. So age affect drug. It means if you have a less age, so there will be the absorption will be the less, distribution will be the low, metabolism will be low, not normal, excretion will be low, as well as sensitivity to drugs. It means when you are in the age like this, it will be the sensitivity to drugs. It means your body will sensitivity to drugs. Now children, if I'm talking children, is immature hepatic enzyme and renal functions may increase drug toxicity. So in why here is written in immature hepatic enzyme and renal functions may increase drug toxicity. Can you give me in comment sections if you know? Immature hepatic enzymes, basically this is for children, and renal functions may increase drug toxicity. You tell me how increase drug toxicity this immature hepatic enzyme and renal functions. I just want to know in a simple word, okay? Not a long, just simple. So anyone can look and they also study easily. Example, chloramphenicol. This is gray baby syndrome in neonates. Chloramphenicol, gray baby syndrome in neonates. This is this is to be given where found that gray baby syndrome. Okay. Now elderly. So let's talking about the elderly. In elderly, there is a decreased renal function. This is the another case. You will find that when someone is elder, you will find that renal functions and hepatic metabolism increase sensitivity to CNS and dispassions. Example, benzodiazepines may cause excessive sedations fall. Benzodiazepine may cause excessive sedations and falls. Now, clinical relevance, dose adjustment is often required. So, body weight and body consumptions. Drug doses may depend on body weight or body surface area. Example, many anti-cancer drugs are calculated in mg per meter square. Clinical relevance. Clinical here relevance is dose adjustment is often required. In this case, dose adjustment is often required. Clinical relevance is incorrect dosing may cause therapeutic failure or toxicity. Incorrect dosing may cause therapeutic failure or toxicity. Are you looking for to understanding what actually here? Incorrect dosing may cause the therapeutic failure or toxicity. So there is need to correct dosing. Incorrect dosing may cause therapeutic toxicity or failure. And now third one is sex. I discuss about that age. In age I discuss the children, elderly, and second one is body weight and body consumptions. Third one is sex. Pharmacological response may vary between males and females because of difference in body consumptions, hormones, and drug metabolisms. Pharmacological response may vary between males and females because of difference in body compositions, hormones, and drug metabolisms. Yes, females and male they have a body compositions and hormones and drug metabolisms is differences, so it can be the vary. Example, women may become more susceptible to drug induced QT prolongations with some drug. And now fourth one is genetic factor, pharmacogenetics. Genetic variations can produce differences in drug metabolism and response. So if there is a genetic variations can differences in drug metabolism and response. Example, isoniazid, solo acetyl have higher drugs levels and greater toxicity. Succinylcholine, pseudocholinesterase deficiency, prolonged apnea. Warfarin, genetic variations of effective dose requirement. This is the example of genetic factors, isoniazid and succinylcholine. So I think I not need to mention all the things, just you write the genetic factor. Just like if you unable to write properly, you can write in the simple way. Yes, it will be helpful for you. Okay, just like given, describe with clinical relevance and innovate and describe with example. But when it's asking in that way, so you have to some little bit write about them, which your teachers will satisfied with your answer and give you the good marks. So genetic factor, there will be the drug isoniazid, succinylcholine, warfarin. Warfarin genetic variation affect dose requirement. Now, clinical relevance. Some dose can produce different therapeutic or toxic response in different individuals. A route of drug administrations. Route influence bioavailability. You know the bioavailability? Bioavailability. Bioavailability. One set intensity of actions. How I just want to make you the understand about the bioavailability. Actually, bioavailability, how I can make you understand? Just I can make you understand by the first pass metabolism. So we can easily correlate first pass metabolism bioavailability. You know, when you taking from the orally, the first pass metabolism will be high. But when you're just taking the drugs through the intravenous, intramuscular, first pass metabolism will be low. So the effect of the drug will be high and it will cure from whatever you're facing the problem. But the case here is why this so you will explain you will speak that why we are taking the orally. So we will try to take the that drugs, that medicines which is taking the intravenous, intramuscular, but the cost, but the price. So that's why anyone taking the orally drugs who is not insufficient to take the intravenous, so they unable to take, so they usually taking the orally. So that's the thing. Let's discuss first and then we will look at another things. So root influence bioavailability, one set intensity of actions. Just like here written about intravenous rapid one set 100% bioavailability. So yes, I'm telling you now, 100% bioavailability. What I have said, when you're taking the drugs from intravenous, your first pass metabolism will be low. Oral, subsequent to absorptions and first pass metabolism, subject to absorption and first pass metabolism. First pass metabolism, sublingual, rapid absorptions and avoid first pass metabolisms. Are you something listening? Outside my room, what they are going, you know very well about the hostel life students. Subject to absorptions and fast pass metabolism, sublingual, oral, subject to absorptions and fast pass metabolism, sublingual, there will be the rapid absorptions and avoid first pass metabolisms. An example is sublingual is nitroglycerin is used for rapid relief of angina. Rapid relief of angina, sublingual. Nitroglycerin is used for the rapid relief of angina. Dose. The intensity of drug action generally increases with dose until a maximum effect is reached. And sixth one is dose. Route of administrations and dose. The intensity of drug action generally increases with dose until a maximum effect is reached. Example: increasing dose of CNS depressants may produce sedation, hypnosis, anesthesia, respiratory depressions. Clinical relevance. The lowest effective dose should be used to minimize toxicity, time of administrations. Drug response may vary with the circadian rhythm. Example: glucocorticoids are preferably administered in the morning to mimic a normal corticosteroid rhythm and reduce the HPA axis suppressions. Pathological conditions. There are many things. Disease can alter drug pharmacokinetics and pharmacodynamics. Disease can alter drugs pharmacokinetics and pharmacodynamics. Renal disease. Renal disease is increased renal excretions, so there will be accumulations of drugs. Example: divozine, required dose adjustment and renal requirement. Liver disease. This is decrease if there is a liver disease, so there will be the decreased hepatic metabolisms, so increased plasma concentrations of some drug. So example is reduction. Dose reduction may be required for some drug extensively metabolism by the liver. Dose reductions may be required for the drugs intensively metabolized by the liver. Heart failure, reduce hepatic and renal perfusions. If heart failure, so there will be the reduced hepatic and renal perfusions may alter the drugs eliminations. Reduced hepatic and renal perfusions may alter drug eliminations. Ninth one is drug interactions. One drug may modify the action of another. One drug may modify the action of another. May modify the action of another drug. Pharmacodynamics interaction. One drug alter the absorptions, distribution, metabolisms, and excretions. Example: full full है एकदम पता है आपको. You know very well how he is full. Enzyme reactions decrease contraceptive efficacy. I can show you in the outside also, but I do not want to go. Okay, it's no problem whatever happened here there. This is the daily basis case. This is the it's not any issue for me. I just want to come. I just wait, man. I just coming. No any issue, man. I just bore you, man. There is many things else. There is many things to remember. Just bore. Pharmacodynamics interactions. Drug interact at the level of the pharmacological effect. Example: alcohol and band alcohol. Pharmacodynamics interaction. Drugs interact at the level of the pharmacological effect. Alcohol, benzodiazepines, access, CNS depressions. Tennis tolerance. Having an increased dose of the fluid has the same effect as morphines. I just want to show you. Just wait. I just want to show you. Just look.
हम और ध्यान देंगे, कोई दिक्कत नहीं है। हम किसी के घर में दुश्मनी नहीं चाहते हैं, मेरा घर में सब दूसरा है, देखो।
This is the normal thing. I do not want to go there. You have seen, man, I think very well. This is the normal case. Okay. Okay, it's no any issue. Whatever happened there, I don't want to go there. Is I'm recording still? Oh shit. Okay. Yes, it's recording. I think it is to be going 1 hour approx. So I think there is the page is left. I think 10 pages are there. So I have to finish it anyhow today. Alexis, if he begins with a further dose, is produced progressively less efficient, and cumulations. Cumulation occur when a drug is administered repeatedly before previous dose is completely administered, resulting in progressive accumulations. Example is dioxins, particularly in renal impairments. Clinical evidences may result in the drug toxicity. Idiosyncrasy is an unusual and predictable response to drugs occurring in certain individuals, often due to genetic factors. Examples: Primaquines. Primaquines hemolysis into the patients with glucose 6 phosphate deficiency 14s. Oh my goodness. What are you studying, man? I don't understand. There is many returns. Drug allergy, hypersensitivity. Physiological factors. Placebo effect. No need to write all the things. Drug allergy, hypersensitivity, you have to write only penicillin, then urticaria or anaphylaxis. Clinical relevance, you have to write severe reactions require avoidance of the offending drugs. Severe requirements require offending the drugs. Psychological factor, placebo effect. Patient expectations and physiological factors can influence the perceived response to it. Example, Example is placebo may produce improvement in subject symptoms such as pain. Clinical features important in clinical trials and management of subject and symptom. And 16 was patient compliance or adherence. Failures to take the drug as prescribed can lead to inadequate therapeutic response. Examples: poor adherence to antihypertensive, uncontrolled hypertension. Environmental and dietary factors, just like smoking. Food Food may increase, decrease orderly drug absorptions and can alter the absorption of certain orally administered. And another question: organophosphate compound, organophosphate compound, organophosphate compound, organophosphate compound, organophosphate compound. Management drug treatment, general principle of acute poisoning, principle acute poisonings. Paper 1, this is a paper 1. Paper 1. I don't understand, man, how I will remember all the things. I'm just scared with myself that how I will do, what I will write in my exam on that time. I'm very fear with the Parisar, Bapu Pariksha Parisar, Bapu Pariksha Parisar. So on that, this is the largest exam center in India. You have to go there and you have to give by on your effort. But I can fulfill my effort when I do my best in a days there. Then it will be the easiest for me to give an answer, write all the thing appropriately, whatever. But need to remember, it is not a cup of tea. Organophosphate poisoning is an acute chronic toxic syndrome caused by inhibitions of acetylcholinesterase caused by organophosphate poisoning is an acute chronic toxic syndrome caused by inhibition of acetylcholinesterase resulting in accumulation of acetylcholine, muscarinic, nicotinic, and CNS side. Mechanism: organophosphate poisonings irreversibly inhibit of AC inhibitions. Irreversibly inhibition of AC increase acetylcholine, muscarinic and nicotinic CNS manifestations. Clinical features: muscarinic meiosis, salivations, lacrimation, sweating, bronchospasm, vomiting, diarrhea, urinations. Nicotinic is muscles, fasciculations, muscle weakness, paralysis. In CNS and in CNS, what you have to mention about CNS, nicotinic. In nicotinic, it can be the muscle fasciculation, muscle weakness, paralysis. So CNS, anxiety, restlessness, confusions, coma, respiratory depressions. Important cause of death: respiratory failure due to bronchuria and bronchospasm, respiratory muscle paralysis, and CNS depressions. So the management, if I'm talking management, immediate suppurative managements, ABC, airway, breathing, and circulations. Management is clinical, I have discussed already, and definitions and clinical features. Okay, clinical features I have written. Management is first, it is immediate supportive management, airway, breathing, and circulation. No need to write all the thing. Airway, maintain airway and suction secretions. Breathing, give oxygen and provide assisted ventilations, intubations when required. Circulation, establish IV access and monitor BP, pulse, and ECG. Establish IV access, monitor BP, pulse, and ECG. And so decontaminations, remove contaminated clothing, wash skin thoroughly with soap and water. Prevent health worker from secondary contaminations. Third one is central complication, treat seizure and with benzodiazepines. Example, diazepams and lorazepam. Correct. Hypoxia and other metabolic abnormality. And fourth one is drug treatments. Drug treatment is atropines, the main antidote. Atropine is a competitive muscarinic receptor agonist. Pharmacological basis. What is pharmacological basis? What you will discuss about the pharmacological basis? Increase acetylcholine and there will be the atropine block muscarinic receptor. Increase acetylcholine, atropine block muscarinic effector. So the reverses is bronchoria, bronchospasm, bradycardia, excessive salivations, lacrimations. Important point: this atropine does not reverse nicotinic muscles weakness and paralysis. What I have told you that atropine does not reverse nicotinic muscles weakness. Atropines is the drug which cannot reverse nicotinic muscles weakness, and paralysis, which cannot reverse. And in several organophosphate poisonings, atropine is given IV and titrated repeatedly according to the clinical response rather than using a fixed total dose. Pyridoxines mechanisms. Pyridoxine is an acetylcholinesterase. Pyridoxine is an acetylcholinesterase activator. This is an activator. It removes the organophosphate group from inhibited ACHE if administered before aging of the enzyme. Pharmacological basis. Organophosphate plus ACHE inhibit the ACHE. Pyridoxines reactivate this ACHE. Acetylcholinesterase. Acetylcholinesterase decrease acetylcholine, so improve in nicotinic muscles weakness and fasciculation and some muscarinic effect. So diazepams and lorazepam. What is diazepam? Benzodiazepines are used for convulsions, severe agitation, CNS manifestation. They enhance GABA-A receptor mediated inhibition. So whatever the important questions, basically I will study. General principle of acute poisonings, treatments, establishments, airway, breathings, and circulations. Identify the poisons. History, drug content, clinical trial, appropriate laboratory investigations. Then prevent further exposure. So we have to stop. General principle of auto poisoning treatment. Identify the poisons and prevent further exposures, remove contaminated clothing, and wash exposed skin, eye appropriate, ensure staff safety, and purpose reduce absorptions depending on positions and timing. Activate charcoals may be considered for selected reagent industries. Gastric lavage is not routinely recommended and has very limited indications. Do not induce vomiting and routinely. Eliminations and enhance eliminations when appropriate. Urinary alkalization is selected poisoning. Multiple dose activation. Charcoal for selected toxins. Hemodialysis for certain digestible poisons. Specific antidote. What I'm studying, I'm not understanding, not appropriately. But I just try to study one time. Then, if I will understand, then I will remember. Otherwise, I will not. Example: organophosphate, atropine, and paralidoxine, opioids, naloxones, and paracetamols, and acetylcysteines. Benzodiazepine is flumazine, a selected case. Supportive treatment: oxygens and ventilation other maybe fluid, other correct electrolyte and glucose. Treat arrhythmias, seizures, and shock. So monitoring the continuous monitoring consciousness and respiratory functions, pulse, APEC, oxygen saturations, urine output. Now it is going to, there is only some pages are there. So adrenaline, pharmacological actions, therapeutic use, adverse effect, precautions while administering. What is the adrenaline? Adrenaline is epinephrine. Definitions. The paper one questions. Adrenaline is a sympathomimetic catecholamines and a potent against alpha 1, alpha 2, beta 1, and beta 2 adrenergic receptor. It is the drug first choice in anaphylaxis and is also used in cardiac arrest and several emergency conditions. So this drug which is used in cardiac arrest and several other emergency conditions. And now second is pharmacological actions. What is the pharmacological action of adrenaline? What is the pharmacological actions of epinephrine? Pharmacological action is epinephrine cardiovascular system. One is cardiovascular system. So in cardiovascular system, how the word and all the thing which is mentioned. So let's see pharmacological action. So in cardiovascular system, this is a heart. There is in beta 1 action. So there will be the receptor beta 1. So beta 1 actions. So the adrenaline which is act on this receptor. So there will be the increased heart rate, positive chronotropic effect. So decrease if there will be the increased heart rate. So there will be the increased force of cardiac contractions. If the increase of force of cardiac contraction, it means I can say positive entropic effect. There is a positive entropic effect. Cardiac output, increased cardiac output, and there will be the increased myocardial oxygen demand. If the increase of cardiac output, there will be the increase of myocardial oxygen demand. So here actually what's there is going, we can use the ischemia, increase myocardial oxygen demand. Ischemia when occur? It's occur when insufficient amount of blood is going to the heart. Then there is ischemia in heart, you will find. Increase myocardial oxygen demand, so there will be the oxygen demand. How it's occur? So how ischemia of heart is occur? Suppose this atherosclerosis occurred in arteries or vein, so there will be the ischemia, it will be the arise, and there will be the conditions which is it means the blood which going to the heart will be less because narrowing of artery which the which the blood unable to go, so blood is not able to go, so there will be the oxygen cannot be supplied. Good oxygen amount of good oxygen amount will not supply, so it will be the cell death, necrosis. There we can use their anemia, cell death. It can be there. It will be there. And now blood vessels, there will be the alpha 1 and beta 2 actions. I know the in heart there will be the in beta 1 receptor. In blood vessels there will be the alpha 1 and beta 2 actions. So in alpha 1 vasoconstrictions, alpha 1 which help to vasoconstrictions, when the adrenal which work in alpha 1 receptor, so it will be the vasoconstrictions. It means vasoconstriction, it means when the heart is about to contract, so good number of blood will be out and spreading to the all the body. And if it is spreading the all the body, there will be the carrying oxygen. It will also supply to all over the tissue of the body, and there will be the going the metabolism, the function of the cell. They will make the ATP. The system of the whole activity will be occurring through this kind of process of curriculum. And increased peripheral resistance, so it will be the increased peripheral resistance, so increase BP. So beta 2 receptor vasodilations in skeletal muscles vessel. So beta 2 which is also present in the blood vessel, which also help to vasodilations skeletal muscles. At usual therapeutic dose, beta 2 dilator effect can reduce peripheral vascular resistance. It can reduce peripheral vascular resistance, while higher dose produce more prominent alpha 1 mediated vasoconstrictions. 8. Respiratory system. In respiratory system, there is beta 2 actions occur, which is beta 2 action occur bronchodilations and decrease bronchial smooth muscles contractions. It's help to decrease the smooth muscle contract and reduce airway edema through alpha 1 mediated vasoconstriction. This particularly important anaphylaxis. So if I'm talking about eye, beta 2 mediated relaxation of the ciliary muscles, alpha 1 mediated vasoconstrictions produce mydriasis. So in the gastrointestinal tract, so if I'm talking about gastrointestinal tract, GI, relax GI smooth muscle, decrease intestinal motility, and tone sphincter to tone may increase. Urinary bladder, relax detrusors by a beta 2 and beta 3 effect. Increase bladder neck, internal sphincter tone by a alpha 1. So F will be metabolic actions. Metabolic action, increase gluconeogenesis, increase blood glucose, increase lipolysis, so increase will be free fatty, may cause hypokalemia by beta 2 mediated intracellular Kaise. And I just about to completing. There are some pages are left. Some pages, few pages. Some not few pages are left. Few. It means it can be 2, 3, 4 like this. Therapeutic use is anaphylaxis drug of choice. Route is intramuscular, usually into the anterolateral thigh. Pharmacological basis: alpha 1, beta 2. Alpha 1 increase the vascular tone, alpha 1 increase vascular tone and decrease mucosal edema. Beta 1 support cardiac output, and beta 2 bronchial dilations and reduce bronchodilation and reduce mediators release. So adult dose is 0.5 mg intramuscular of 1 mg per ml. It means the ratio is 1:1000. Solutions may repeated every 5 minutes according to response. Now the cardiac therapeutic use, one is anaphylaxis, cardiac arrest, So cardiac arrest route we will give the intravenous during CPR. Pharmacological basis. There will be written the many thing, man. I just confused, bored these kind of things. Alpha 1 mediated vasoconstrictions increase coronary and cerebral perfusion pressure during the CPR. Adult dose is 1 mg intravenous or 0.1 mg per ml, 1:2000 solutions every 3 to 5 minutes during arrest. And cardiac acute severe bronchospasm asthma is selected emergency situations, beta 2 stimulation, bronchodilations. It is especially useful when bronchospasm occur at the part of anaphylaxis. With the local anesthesia, adrenaline is added to some local anesthetic preparations and alpha 1 vasoconstrictions. This alpha 1 vasoconstrictions which decrease the local blood flow and decrease the systematic absorptions, prolong local anesthetic action and reduce bleeding. Fifth is control of superficial bleeding. Topical and local adrenaline produce alpha 1 mediated vasoconstriction reducing bleeding in from mucosal surface. And there is adverse effects cardiovascular, palpitation, tachycardia, hypertension and arrhythmias, angina, myocardial ischemia and susceptible patient. CNS will be anxiety, restlessness, tremor, headache, insomnia, metabolic, hyperglycemia, hyperkalemia, and locals excessive administrations, excessive vasoconstrictions, tissue ischemia, extra vacations can cause local tissue injury. Precaution while administering adrenaline, correct concentration and route, very important. Intramuscular anaphylaxis. Muscular anaphylaxis 1 mg per ml, 1:2000. Intravenous cardiac arrest is 0.9 mg per 1000. According to resuscitation sub protocols, never accidentally given the I1 mg per ml solutions via intravenous. So finally guys, I finished whatever I have taken the challenges I have to complete. Before I have told you that I have to complete 30 plus pages, so which I have studied. Finally guys, you can look, I have studied. Now you can look, finish. I have one time study, man. At anyhow, suppose if I am understanding 30 plus page only 2%, anybody will say what is the benefit. You just invest, you spend your time. I think you can look about 1 hour something, 20 or 15 minutes like this, but you only understand 2%. You are saying 2% you understand, so what is the benefit to study? I just told you this is the struggle. This is the struggle for the study and to succeed. Suppose if I am understanding, if I am not capable to understanding many things, but someone they capable teacher to understands, how they success. If I am understanding 2%, then I will stop to studying. This is your mindset, I think. Am I right? So this kind, I never taking this kind of. If I am understanding 2%, next time I will study. I will understand more. It will be easiest for me to understanding more and can explain very easily whatever the written here. So how I can make concise. But it is a long way it is given how I will write in that in my languages. I have to write in my languages. 30 page. I cannot remember all the things whatever. I cannot write exactly copy in examinations. It is not possible. Yes, it's possible. Someone who able to in rectifications, they can do easily and they can write very well. But I do my best to give answer very good way and appropriate way. So sorry guys. So I want to finish here the video. So I will come back soon. So I will meet you again, man. So you stay tuned in this way, and really your one comment for me a good motivation for me, whatever as you giving as a positive feedback or negative feedback for my reading purpose like this, it's no any issue for me. Somehow if someone giving the negative comment, it's really I'm tell you, it give me more and more confident to something doing best. If someone they're going doing that's they cannot do anything else like this, if they're saying like this, then I am very more energetic. Someone saying me that I cannot do anything, you cannot do anything, from my side it's I have to do something great, good thing which I can show to those man, those person who tell me the cause of myself is not good. I want to show that things. That is the case, man. And no any issue, man. No problem. You are the person. You are freedom. You can do anything. You can comment anything else. If you comments the good comments for me, it is good. Thank you for good comments. If you negative comments, okay, it will also the thank you. Still you coming in my video and just looking something and just finding the mistake. And if you're finding the mistake, thank you for my mistake which you grip and which you tell me. I will definitely improve. That's my mistake. So that's the things is going, and definitely one time I will definitely all the thing whatever the problem whatever definitely it's overcome. It is not possible from the one day. It is not possible. I'm sure. And okay guys, I will meet you, and it is a nice conversation and reading. This is the finest for me to meet to you, and next time I will meet you again. Thank you. Nice to meet you, man.